Welcome to today's video on the early warning signs of heart failure. Signals your body might already be sending, but that most people don't recognize until it's almost too late. Every single year, over 6 million Americans are diagnosed with heart failure, and millions more around the world live with it unknowingly. The tragedy is that many of the earliest symptoms appear months, or even years, before the heart reaches a critical state. But because these warning signs mimic normal aging, mild fatigue, or stress, people tend to dismiss them. Yet behind these subtle changes, your heart could be struggling to pump enough blood to nourish every cell in your body. When that happens, oxygen delivery to vital organs declines, waste removal slows, and fluid begins to accumulate where it shouldn't. Today, we'll uncover 13 scientifically verified signs of early heart failure that often go unnoticed. Signs that could literally save your life if caught early. You'll learn what to watch for, what these symptoms mean biologically, and when it's time to see your doctor. Please note, this video is for educational purposes only and not a substitute for medical advice. All research is cited from leading medical journals and organizations, including the American Heart Association and the National Institutes of Health. Sign number 1, needing more pillows to sleep comfortably, orthopnea. Do you find yourself needing more pillows at night to breathe comfortably, or even preferring to sleep upright in a chair? That's not just a matter of comfort. It's a clinical warning sign called orthopnea. Here's the science behind it. When you lie flat, gravity no longer helps your body drain blood from your legs and lower extremities. In a healthy heart, this isn't a problem. But if your heart's left ventricle is weak, blood starts to back up into the pulmonary veins, the vessels that carry oxygenated blood from the lungs to the heart. As pressure builds, fluid leaks into the tiny air sacs of your lungs, making it harder to breathe when you're lying down. This fluid buildup is called pulmonary congestion, and it's one of the hallmark signs of left-sided heart failure. According to research from the Cleveland Clinic, up to 80% of heart failure patients experience orthopnea, often long before they realize they have a heart condition. The change usually happens gradually. One pillow turns into 2, then 3, until sleeping flat becomes impossible. If you've noticed this gradual shift, it's time to take it seriously. Your heart might be struggling to handle normal fluid circulation while you rest. Sign number 2, waking up gasping for air, paroxysmal nocturnal dyspnea. Imagine waking up in the middle of the night, gasping for air, your heart pounding, and an overwhelming sense of panic washing over you. This frightening episode is known as paroxysmal nocturnal dyspnea, PND, and it's a critical red flag for heart failure. Here's what's happening physiologically. During the day, gravity pulls fluid into your legs and feet. When you lie down to sleep, that fluid redistributes into your bloodstream. A healthy heart easily manages this shift, but a weakened heart cannot. The sudden increase in circulating blood overwhelms your already strained left ventricle, causing fluid to surge into the lungs, making you feel like you're drowning in your sleep. Clinical studies show that PND episodes typically occur 2 to 4 hours after falling asleep and can last several minutes. Many patients describe feeling an urgent need to sit up, open a window, or rush outside for air. Unfortunately, many mistake this symptom for asthma, anxiety, or sleep apnea, delaying treatment. But unlike those conditions, PND tends to occur after lying flat for several hours and is directly linked to fluid buildup in the lungs. If you've ever woken up like this, even once, it's a strong signal to seek medical evaluation immediately. Sign number 3, fatigue and reduced exercise tolerance. Among the earliest yet most easily dismissed warning signs of heart failure is a deep, persistent fatigue, the kind that doesn't go away even after a full night's rest. This isn't ordinary tiredness. It's your body running on low energy, because your heart is no longer pumping blood efficiently enough to meet your body's metabolic demands. When cardiac output decreases, the body activates compensatory mechanisms like the sympathetic nervous system and the renin-angiotensin-aldosterone system, RAS, to maintain blood flow to vital organs, mainly the brain and heart. To do this, blood flow is diverted away from skeletal muscles and the digestive system, leading to muscle weakness and chronic exhaustion. Over time, reduced oxygen delivery to muscle tissues causes mitochondrial dysfunction, meaning your cells literally produce less energy, ADP. The result? Even small efforts, climbing stairs, carrying groceries, or walking short distances feel like an uphill battle. Clinical research published in the European Journal of Heart Failure identifies fatigue as one of the most underrecognized early markers of declining ejection fraction, the percentage of blood your heart pumps out with each beat. Many seniors unconsciously adapt. They move less, rest more, and gradually normalize their symptoms. But make no mistake, this isn't normal aging. It's your heart signaling that it's struggling to sustain your body's basic energy supply. If your stamina or recovery time has declined significantly, it's time to take notice. Persistent fatigue is one of your heart's quietest, but most important cries for help. Sign number 4, swelling in the ankles or legs, peripheral edema. Next comes one of the more visible warning signs. Persistent swelling in your ankles, feet, or lower legs, known medically as peripheral edema. Unlike temporary puffiness from sitting too long, this swelling deepens gradually and worsens by evening. The reason lies in the heart-kidney connection. When your heart's pumping action weakens, blood flow through the veins slows down, particularly in the lower extremities where gravity exerts its pull. This causes venous congestion, where blood pools in the veins of the legs. At the same time, your kidneys, sensing a drop in blood volume, activate hormonal systems that cause them to retain sodium and water. The combined effect pushes fluid from the blood vessels into the surrounding tissues, leading to noticeable swelling. Scientific studies in the Journal of the American College of Cardiology estimate that about 70% of people with heart failure develop measurable peripheral edema, often before more severe symptoms appear. The swelling usually starts around the ankles and progresses upward to the calves or thighs. You might notice sock marks or shoe tightness by evening, or rings that suddenly feel snug. A telltale sign is pitting edema. When you press the swollen area with your finger, it leaves a visible indentation that stays for several seconds. This pattern, symmetrical swelling that worsens throughout the day, is a critical clinical clue that your heart is retaining fluid, not simply aging or water retention from diet. Sign number 5, rapid weight gain from fluid retention. While fatigue and swelling can develop gradually, sudden weight gain is one of the most measurable and alarming early signs of heart failure. This isn't from overeating or normal fluctuations. It's your body holding on to excess fluid. When the heart's pumping ability declines, your kidneys receive reduced blood flow. In response, they trigger neurohormonal compensation, primarily through the renin-angiotensin-aldosterone system, which tells your body to conserve salt and water to increase blood volume. But in heart failure, this mechanism backfires, causing fluid overload instead. The American Heart Association, AHA, warns that gaining 2 to 3 pounds in a single day or 5 pounds in a week is a red flag that fluid is accumulating internally. Each kilogram of weight gain roughly equals 1 liter of retained fluid. Research shows that these subtle shifts in weight often precede hospitalizations by up to 2 weeks, making daily weight monitoring one of the most effective tools for early intervention. Unlike gradual weight changes, this gain is consistent and accompanied by symptoms like bloating, abdominal fullness, and swollen ankles or hands. Your scale, in this case, becomes a life-saving device, a simple reflection of your heart's changing workload. Sign number 6, shortness of breath during normal activity. The first and most common early sign is shortness of breath, or what doctors call exertional dyspnea. This isn't about being out of breath after a workout. It's when simple activities like walking to the mailbox, climbing a few stairs, or carrying groceries suddenly leave you winded. Here's what's happening inside your body. Your heart's pumping ability has weakened, meaning it can't deliver enough oxygen-rich blood to your muscles during activity. To compensate, your lungs work overtime, trying to draw in more oxygen. As a result, you start breathing faster and deeper. Even though the problem isn't in your lungs, it's in your heart. Scientific studies show that less efficient cardiac output during exertion causes microaccumulation of fluid in lung tissues, subtly reducing oxygen exchange. This often begins months before other visible signs of heart failure appear. So if you find that everyday tasks are becoming unusually exhausting, don't just assume it's aging or low fitness. It could be your heart signaling distress, and early detection at this stage can prevent irreversible damage. Sign number 7. Frequent nighttime urination, nocturia. Another overlooked yet revealing symptom is nocturia, the need to urinate several times during the night. Many older adults assume this is due to age or drinking water before bed, but in reality, it can be a cardiac symptom. During the day, when you're upright, gravity causes fluid to collect in your legs and feet. In people with a healthy heart, this fluid is efficiently circulated and filtered. But in heart failure, the weakened cardiac output prevents proper fluid return to the kidneys. When you lie down at night, gravity redistributes that fluid back toward the central circulation, increasing blood flow to the kidneys. As a result, the kidneys begin producing more urine to eliminate the sudden surge in fluid, leading to frequent nighttime trips to the bathroom. Clinical research in the International Journal of Cardiology highlights nocturia as a subtle early indicator of heart dysfunction, often appearing before noticeable swelling or shortness of breath. Patients often report waking up 3 or more times per night, with large urine volumes each time. The underlying cause is fluid redistribution, not excessive fluid intake. This pattern reflects your heart's reduced efficiency in maintaining normal daytime circulation and can serve as an early diagnostic clue when combined with other symptoms. Next, sign number 8. Night cough or wheeze when lying down. A persistent cough that surfaces mainly at night or when lying flat may seem harmless, but it can be a subtle yet serious indicator of early heart failure. Unlike the productive cough of a cold or the dry cough of allergies, this one is typically a nagging, dry, and positional cough that worsens when you recline and improves upon sitting upright. The science behind this lies in how your body manages fluid redistribution. When you lie flat, gravity allows fluid that accumulated in your legs during the day to move back into circulation. In a weakened heart, this extra volume increases pulmonary capillary pressure, pushing fluid into the lung tissues, a condition known as pulmonary congestion. Your body instinctively responds by coughing in an attempt to clear the fluid or open the airways. Medical literature identifies this as a hallmark of paroxysmal nocturnal dyspnea, a symptom linked to rising pressures in the left ventricle and pulmonary veins. Some people also experience a slight wheeze, often mistaken for asthma, and may even notice small amounts of white or pink frothy sputum, indicating early fluid leakage into the alveoli. Research in the European Heart Journal notes that these symptoms frequently occur hours before dawn, when the body's fluid distribution is at its peak. Because it mimics respiratory problems, this warning sign is often misattributed to sinus issues, allergies, or room humidity, delaying proper diagnosis. Sign number 9, palpitations or irregular pulse. Your heart's rhythm can serve as an early alarm system for cardiac decline. Palpitations, sensations of fluttering, pounding, or skipped beats, are common in the initial stages of heart failure. As the heart muscle weakens, its electrical conduction becomes unstable, leading to arrhythmias such as atrial fibrillation, AFib, or ventricular ectopy. Clinically, this happens because damaged cardiac cells disrupt the flow of electrical impulses, causing the chambers of the heart to beat out of sync. You might feel as though your heart is racing even at rest or experience irregular thumps that make you uneasy. Studies from the Journal of the American College of Cardiology reveal that AFib and heart failure share a bidirectional relationship. One can trigger or worsen the other, forming a vicious cycle that accelerates disease progression. These palpitations are most noticeable at rest or while lying down, when external distractions are minimal. The sensation can cause anxiety or shortness of breath, further stressing the heart. While benign palpitations can occur from caffeine or stress, persistent irregular rhythms, especially when accompanied by fatigue or swelling, demand urgent medical evaluation. Sign number 10, dizziness or near-fainting episodes. Frequent lightheadedness, dizziness, or episodes of near fainting, known medically as presyncope, can signal a failing heart. The mechanism is rooted in reduced cardiac output. Your heart is no longer pumping enough blood to maintain steady oxygen delivery to the brain, particularly when changing posture or during mild exertion. In a healthy individual, standing up triggers an immediate adjustment in heart rate and vascular tone through the baroreceptor reflex, maintaining stable blood pressure. But in someone with early heart failure, the weakened myocardium cannot respond efficiently, leading to temporary drops in cerebral perfusion. This results in dizziness, blurred vision, or even brief fainting. Clinical data suggests that syncope occurs in about 15 to 20% of heart failure patients, often months before overt symptoms appear. These episodes are sometimes misdiagnosed as dehydration or inner ear problems. However, when paired with other signs, swelling, fatigue, or palpitations, they often reflect low ejection fraction, meaning the heart's pumping efficiency has declined significantly. Sign number 11, abdominal bloating, poor appetite, or early fullness. While heart failure is often viewed as a purely cardiovascular condition, its impact extends deeply into the digestive system. Many patients report persistent bloating, loss of appetite, or feeling full after eating small amounts, symptoms that stem from visceral congestion and impaired gastrointestinal perfusion. When your heart weakens, venous blood backs up into the liver and intestines, causing them to become swollen and congested. The result is hepatomegaly, enlarged liver, abdominal pressure, and reduced intestinal motility. This makes digestion sluggish and uncomfortable. Additionally, the vagus nerve, which controls stomach emptying, becomes less active under poor circulation, worsening early satiety and nausea. A study in the Journal of Cardiac Failure highlights that up to 60% of heart failure patients experience gastrointestinal symptoms, often misinterpreted as acid reflux or digestive disorders. The liver congestion can cause pain or discomfort in the upper right abdomen, while excess abdominal fluid, ascites, contributes to bloating and tightness. Over time, this can lead to malnutrition and muscle wasting, a condition known as cardiac cachexia, which drastically worsens prognosis if untreated. Next, sign number 12, bendopnea, shortness of breath when bending forward. Here's a symptom so unusual that most people, and even some doctors until recently, have never heard of it. Yet, it's one of the most specific and revealing early signs of heart failure. It's called bendopnea, defined as shortness of breath that occurs within 30 seconds of bending forward, like when tying your shoes, picking something up, or leaning over a sink. Scientifically, this happens because bending forward compresses your abdominal cavity, increasing intra-abdominal pressure. This added pressure pushes upward on the diaphragm, limiting lung expansion, and simultaneously raises intrathoracic pressure, the pressure inside your chest. For a healthy heart, this temporary change is manageable. But in someone with elevated left ventricular filling pressures, a hallmark of heart failure, this additional stress overwhelms the system. The weakened heart struggles to handle the sudden surge of venous blood returning from the abdomen to the chest, resulting in immediate shortness of breath. Bendopnea was first identified as a clinical phenomenon in 2014 by researchers from the University of Texas Southwestern Medical Center, who observed it as a non-invasive marker of increased cardiac filling pressures. Subsequent studies published in major cardiology journals, including the Journal of the American College of Cardiology (JACC), confirmed that bendopnea occurs in roughly 30% of patients with heart failure. Importantly, it correlates strongly with disease severity and higher mortality risk. What makes bendopnea particularly valuable is its specificity. Healthy individuals almost never experience it. If you notice yourself getting short of breath simply from bending forward, it's a red flag that your heart may already be struggling with internal fluid and pressure overload. Next, sign number 13, cold hands or feet, or narrow pulse pressure. The final warning sign involves circulatory changes that can often be felt before they're measured. If you notice your hands and feet are persistently cold, even in warm weather, or your pulse feels weak and narrow, it may indicate that your heart isn't pumping with enough force to sustain normal circulation. When heart failure develops, the body activates a compensatory mechanism known as peripheral vasoconstriction. Essentially, your blood vessels tighten to redirect blood flow toward vital organs, like your heart and brain, and away from less critical regions, including your skin and extremities. While this helps preserve core function, it leaves your hands and feet deprived of warm, oxygen-rich blood. Over time, this can cause chronically cold or bluish fingers and toes, a condition sometimes referred to as acrocyanosis. Another important circulatory clue is narrow pulse pressure, the difference between your systolic, upper, and diastolic, lower, blood pressure readings. Normally, this gap is around 40 millimeters of mercury or more. But when the difference narrows, say, to 20 millimeters of mercury or less, it signals that your stroke volume, the amount of blood pumped out of the heart with each beat, has decreased. This is a clear physiological sign that your cardiac output is failing. Research published in Circulation, Heart failure indicates that a narrowing pulse pressure is not only an early diagnostic marker, but also a predictor of poor outcomes in patients with heart failure, reflecting both reduced contractility and increased vascular stiffness. You may notice that your extremities take longer to warm up, your nails turn slightly bluish, or your pulse feels faint. These subtle changes are signs your body is fighting to maintain blood flow in the face of a weakening pump. If you've recognized yourself in any of these 13 warning signs, don't panic, but don't ignore them either. Heart failure is a manageable condition when detected early. The key lies in listening to your body's subtle messages before they escalate into emergencies. Many people mistake these gradual changes for aging, stress, or being out of shape. But when several of these symptoms appear together, or when routine activities suddenly feel harder, your heart may be signaling distress. Modern medicine offers powerful tools to manage and even reverse early-stage heart failure, from medications that enhance cardiac efficiency to lifestyle interventions that restore circulation, reduce fluid buildup, and strengthen the heart muscle. So take this as a call to action. Be proactive about your heart health. Monitor your symptoms, track your weight, and consult a healthcare provider if anything feels off. If you found this video helpful, type helpful in the comments. It motivates us to create more science-backed, life-saving health content. And don't forget to like, share, and subscribe to stay informed and empowered about your heart's health. Thank you for watching, and I'll see you in the next video.